Good morning. My name is Amara Zubike, and I'm the Director of Behavioral Health Advocacy and Policy at Boston Children's Hospital, and on the leadership team of the Children's Mental Health Campaign. I will be acting as your moderator for today's session. And on behalf of everyone at Boston Children's Hospital and the Children's Mental Health Campaign, it is my privilege to welcome you to today's webinar, Children's Behavioral Health Crisis, The Time is Now. And we have convened this discussion in the midst of an escalating behavioral health crisis nationwide, with the goal of shedding some light on this incredibly heart-wrenching challenge from our unique perspective as an acute care pediatric provider, as innovators, and as partners in advocacy. And we have over 780 registered attendees who are tuned in today, stakeholders far and wide, including parents, clinicians, lawmakers, advocates, and the media who have signed up to be a part of this discussion, both today and moving forward. And before we begin, I first have the honor to welcome the CEO and President of Boston Children's Hospital, Dr. Kevin Churchwell, who will open today's session with a few remarks. Dr. Churchwell, everyone.
Good morning, everyone. Thank you for joining us as we come together to discuss the critical nature of the children's behavioral health crisis. Right now, we are beginning to see the light at the end of the tunnel of the COVID-19 pandemic, but our children continue to navigate a crisis that feels like an endless tunnel to many. Simply put, our society has not prioritized the behavioral health needs of our children. And it took the upheaval of everyday life caused by the pandemic for everyone to clearly see the detrimental effects of that choice. Our hospital, as an acute pediatric provider, was uniquely positioned to recognize the need for a reformed pediatric behavioral health system long before the COVID-19 pandemic. Over 15 years ago, we were a founding member of the Children's Mental Health Campaign and sounded the alarm on the state of the children's mental health system in Massachusetts. Since then, we have worked with the campaign, families, advocates, legislators, and partner organizations to push behavioral health legislation forward. However, this is not just a local crisis, it's a national crisis as well. So we are also engaging in advocacy on the federal level in collaboration with the Children's Hospital Association. Bottom line, we are devoted to doing everything we can for children's health, even for the children who never come through our hospital doors. As we've pushed for policy change, we're also committed as an organization to enhance and expand our behavioral health care capacity. Since the beginning of the pandemic, we've expanded our outpatient services in both Longwood and Waltham, opened a new inpatient psychiatric unit in Waltham, and continue to provide collaborative behavioral health services in primary care through our behavioral health integration program and in schools through our Boston Children's Hospital Neighborhood Partnership Program. As we continue to do everything we can to ensure equitable access to quality behavioral health care for all children, I want to thank each of you, and each and every one of you. Thank you for your engagement and commitment in this space, whether that be through direct clinical care, administrative effort, or advocacy. We could not do this work without you. I'd also like to thank those who will be speaking during today's session. We have a courageous young man who will be sharing his story, a physician, advocates, and legislative champions, including U.S. Representative Lori Trahan, State Representative Marjorie Decker, and State Senator Cindy Friedman. Thank you for taking the time to share your expertise and engage with us in this important discussion. As we say at our hospital, children are 20% of our population, but 100% of our future. And right now, our future needs all of us to work together to reimagine behavioral health care delivery across the continuum to ensure that children are able to receive the right care at the right time. Thank you.
Thank you, Dr. Churchwell, for your remarks today, but most importantly, for your steady leadership. But before I introduce you to our next speaker, a brave young man and advocate, I would like to get a few housekeeping matters out of the way. This webinar is being recorded, and everyone registered will receive a link to the recording and a copy of the slides. Due to time constraints, we will not have a Q&A session, but please do email your questions to can@childrens.harvard.edu. Also, if you would like closed captioning for a live transcript of today's webinar, please click the button at the bottom of your Zoom screen that says live transcript. This will enable the closed captioning on your screen. So we have a great session today. Our next speaker, Max Casado, is from Boston, Massachusetts, and is a high school student who enjoys soccer, spending time with friends, and video games. Max is also an advocate who shares his story in order to provide encouragement for other youth who may struggle with mental health needs. Max Casado, everyone.
Good morning. My name is Max Casado, and I'm an 11th grader in high school. My family lives in Boston, but I'm currently in boarding school, which is where I'm joining you from now. I've decided to share my story today to let others know that they're not alone in their mental health struggles and they can get to the other side. My struggles with mental health began when I was 11 years old. I was avoiding school, fighting with my parents over irrational things, and struggling to do everyday tasks. Most days, I would sit in my room all day playing video games. Eventually, it got to the point where I threatened to kill myself, and that's when I was brought to the emergency department. At that time, I waited in the emergency room for 3 days before a place became available in the children's CBAT unit. At first, I was very dismissive of the program and didn't believe that it was what I needed. I think most people go through this denial phase in their treatment. But the program did help me learn more about myself and gave me a lot of coping strategies. After I left, I was good for a few weeks, but I started falling back right into old habits. I started playing games more and more and eventually just started giving up on myself. But on Halloween night, I ended up going to the emergency department in crisis because I threatened to kill myself again. From the emergency department, I went to a Franciscan's inpatient unit. I realized I was not as bad as some other kids. I needed to get into better shape and needed to work on myself. Other kids were struggling and I saw I needed to work on myself more. After being in the inpatient unit, I began outpatient treatment. I had to wait 4 to 5 months to get into the anxiety mastery program at McLean, and I was no longer suicidal, but I was still battling anxiety and depression. There, I learned coping skills where I didn't feel as anxious or depressed anymore. Since Franciscans, I have not gone to another inpatient unit, and with the support of my parents and mental health programs that I've been able to access, I've made great progress in my mental health. In the past, I did not always recognize that the support was there, but now I realize it is. And I want all these kids out there to realize that there is a life worth living and that you can get through this. For the advocates and policymakers listening, I appreciate all of you and what you've done for kids' mental health, but it needs to be more accessible. Kids are being sent to hospitals far away from their homes, and many are not able to pay. Kids all over the world are struggling with this problem, and we need to make a difference. Thank you for listening to my story.
Max, thank you for your bravery and your advocacy. Max is proof that we have so many reasons to hope for a brighter future. Our next speaker, Dr. Ibiziaco, is the Associate Chief for Clinical Services in the Department of Psychiatry and Behavioral Sciences at Boston Children's Hospital. She is a compassionate and leading voice in pediatric behavioral health. Dr. Ibiziaco, everyone.
Thank you, Amara, and good morning, everyone. I want to thank Max for sharing his powerful testimony of mental health struggles beginning at age 11. And the first thing I want to highlight is how early in life such struggles can begin. According to the CDC, 1 in 6 children aged 2 to 8 has a diagnosed mental, behavioral, or developmental disorder. The true prevalence is likely much higher since many children are undiagnosed. To break it down even further, between 3 to 5, depression is almost non-existent, but anxiety and behavioral disorders like aggression begin to emerge. By 6 to 11, rates of depression and anxiety start to increase, but behavioral disorders remain the most common. Adolescence is the most vulnerable period for emotional struggles, with higher rates of depression and anxiety between 12 to 17, while behavioral disorders begin to decrease. Let's delve a bit more into adolescent stress before COVID. In a 2013 study conducted by the American Psychological Association, 1/3 of teenagers reported feeling overwhelmed as a result of stress. 83% reported school as their primary stressor, and 34% believed the next school year will be even more stressful. Here in the Northeast, 11th grade students from 2 private high schools were asked about their sources of stress. School grades, homework, and getting into college ranked as the highest sources of stress amongst the students, and girls were more impacted than boys. By 2019, the CDC reported that 1 in 3 high school students endorsed feelings of sadness and hopelessness. In a survey conducted right before the pandemic, 2/3 of US parents said parenting is harder today than 20 years ago, and they cited technologies like social media and smartphones as major reasons. We just heard Max describe spending more time playing video games when his mental health struggles started. A 2013 study showed that the 2 most common stress management techniques used by teenagers were playing video games and surfing the internet or going online. By 2018, 97% of 13 to 17-year-olds were using a social media platform, and 45% reported being online almost constantly. Increased screen time has been linked to social isolation and depression. More than half of US teens have experienced cyberbullying online and on their cell phones, and bullying has been linked to an increase in suicide in youth. Over the 8-year period between 2008 to 2015, there was an alarming rise in children presenting to hospitals all over the country with suicidal thoughts or behaviors. Many of the children represented in this graph were in emergency rooms or medical floors due to a rise in a phenomenon we call boarding that occurs when there's a lack of availability of beds at psychiatric treatment programs. And this reflects a lack of access to care for children with mental health conditions. By 2014, suicide had become the 2nd leading cause of death in adolescents. By 2019, there was a 61% rise in boarding in the 4 years leading up to the COVID-19 pandemic. The pandemic arrived and caused even greater issues for our youth, with more screen time, more sedentary behaviors, more school pressures, and more social isolation. By May of 2020, adolescents themselves were sounding the alarm. 64% felt COVID-19 will have a lasting impact on their generation's mental health. At the beginning of the pandemic, there was an intense focus on infection control processes like wiping down surfaces and hand washing. And we had anecdotal reports of some of our patients with OCD, obsessive compulsive disorder, saying things like, "I have been training for this my whole life." Unfortunately, the situation was too overwhelming. And by the end of the first year of the pandemic, we saw significantly higher volumes of patients with OCD presenting to our hospital in crisis. We looked at trends of children presenting to our hospital over a 2-year period before and after the pandemic onset. This graph shows what we found for anxiety disorders. The red line in the middle of the graph represents the onset of the pandemic. During the 12 months prior to the pandemic, there was a stable trend of children coming to our hospital with anxiety disorders. As the pandemic year progressed, more and more kids were presenting to our hospital with increased anxiety in the context of so much uncertainty. For patients with eating disorders, the overall trend of patients admitted to our hospital during the 12 months prior to the pandemic was pretty stable. Once the pandemic started, however, we saw striking increases as the year progressed that surpassed anything we had ever seen. In addition to increased sedentary behaviors, which affects weight gain, and increased time on social media platforms like Instagram and TikTok, where teenagers can unfavorably compare themselves with others. Teenagers were spending significant amounts of time staring at their own images on platforms like Zoom in the context of remote learning. This can be triggering for adolescents with vulnerability to eating disorders. Sadly, we are also seeing patients who are sicker, with more severe malnutrition and with suicidal behaviors. And this is what suicidal trends look like before and after the pandemic onset. We were already seeing rising rates prior to the pandemic. The pandemic simply exacerbated this, with more adolescents presenting with suicidal ideation and suicide attempts, particularly overdoses. The sad part about this graph is that while there was a difference in the overall volume of patients we saw once the pandemic started, there was actually no difference in the trends between both years. This means that even without the pandemic, suicidal ideation and suicide attempts were on track to rise and continue to rise in American youth. Here in the Northeast, there were more mental health claims for intentional self-harm for adolescents during the first year of the pandemic than any other region in the country. This is what psychiatric boarding at our hospital looked like. This was the period in 2019 that corresponded to a 61% increase in boarding. This is when the pandemic started. By March of 2021, our length of boarding had more than doubled. That month, a survey conducted across 88 US hospitals revealed 99% were boarding youth awaiting psychiatric placement. Northeast hospitals had greater boarding volumes and durations. By the end of 2021, our length of boarding had tripled. We already had an inpatient psychiatry unit, and we rapidly opened another unit by October of 2021. Together with our CBOT program, we were able to increase our acute treatment capacity. Our outpatient volume increased significantly with telehealth, and our school-based program has been able to provide ongoing mental health consultation and support to Boston Public Schools. We are expanding our crisis intervention services for patients boarding and engaging in very active advocacy with key stakeholders to help reduce boarding, which we all agree is not optimal for our patients and families. Max courageously shared his experience about receiving treatment at our hospital in Franciscans. Our goal is to expand this longstanding collaboration through our planned affiliation in order to change the delivery of pediatric mental health care and improve access for patients and families in the Commonwealth. And this includes expanding all levels of care. A priority for us is to expand our multidisciplinary training and education programs to develop the workforce of the future and ensure that we have a highly skilled and diverse workforce that can deliver care that is safe, timely, culturally informed, and evidence-based. We recently studied nearly 100 adolescents who were admitted to our inpatient psychiatry unit from the second year of the pandemic. By the end of their treatment, these adolescents reported significant improvement in their depression, anxiety, and quality of life. We need to invest in resources for research and state-of-the-art care delivery models that allows children to reach their full potential and live their best lives. And we need to share best practices nationally and internationally. This is a challenging time to be growing up in America and around the world. Adolescents like Max have become the greatest mental health advocates of any generation. The time for us to act for our youth is now. Thank you.
Dr. Ibiziaco, thank you for educating us on the current state of the crisis and also for sharing critical solutions. Our next two speakers will provide a national perspective on the children's behavioral health crisis and provide national policy solutions. First, we will hear from United States Representative Lori Trahan, who represents the Massachusetts 3rd Congressional District. Then we will hear from Amy DeLong, who is the Director of Federal and External Relations in the Office of Government Relations at Boston Children's Hospital. Lori Chahan, everyone.
Hi, I'm Congresswoman Lori Trahan, and I proudly represent Massachusetts' 3rd Congressional District. I want to take this opportunity to thank Boston Children's Hospital and the Children's Mental Health Campaign for convening this important conversation about children's behavioral and mental health. As the mother of 2 young girls, I know just how important it is that we meet this moment and ensure that our children have the support and resources they need. There's no question that the pandemic has taken a heavy toll on children, teens, and young adults. Before the pandemic, about 1 in 5 children experienced a mental health condition, and we know that the past 2 years have only exacerbated those numbers. We must enact solutions to this pressing issue, and I'm proud to partner with all of you to do just that. As a member of the House Energy and Commerce Committee's Health Subcommittee, I'm able to take up a lot of these issues at the earliest stage of policymaking. In fact, we've already started to address these issues in several ways during this congressional session alone. Last year, I introduced the Youth Mental Health and Suicide Prevention Act, legislation to support positive mental health promotion and suicide prevention programs in high schools. And just last month, my colleague and the chair of the Health Subcommittee, Congresswoman Eshoo, introduced the Strengthen Kids' Mental Health Now Act. This critical legislation would provide a much-needed investment in the nation's mental health infrastructure for children, and I look forward to supporting it when it's scheduled for a vote. Far too many families here in Massachusetts and across our country have been immeasurably impacted by mental health struggles made worse by a lack of accessible support and resources. We know that investments in education, treatment, and strengthened mental health services are needed to ensure that no stone is left unturned in our fight to end youth suicide and support children's mental health. As we continue our work on this important issue here in Washington, I'm grateful to have Boston Children's Hospital, the Children's Mental Health Campaign, and many other valued partners leading the way. So thank you again for the opportunity to join you for this panel. And thank you for your incredible work to support our youth in the Commonwealth and across our country.
Hi, my name is Amy DeLong, and I'm the Director of Federal and External Relations here at Boston Children's Hospital. And in my role, I get to work with my counterparts and colleagues at peer institutions across the country, which allows for some insight into the challenges that they are facing in other parts of the country. So I can tell you with certainty that on these issues that everyone has been speaking about, the escalating crisis in children's behavioral health and the challenges associated with boarding these patients for long periods of time are not unique to us in Massachusetts. This is happening everywhere across the country, and it does beg for a national response. So we are working together with other children's hospitals and the Children's Hospital Association to address this crisis at a federal level in partnership with members like Representative Trahan, who we just heard from. And we actually joined together the children's hospitals along with the AAP, the American Association of Pediatrics, and ACAP, which is the American Academy of Child and Adolescent Psychiatry, in an awareness raising campaign that we are calling the Sound the Alarm for Kids Mental Health campaign. And we can put a link to that in the chat. And this is what the website looks like that you can see on the slides. Through this campaign, we've hosted congressional roundtables and worked together to raise awareness and support policies that promote the social and emotional health of all children. And if you check out the website, you can sign up and follow along as this campaign, which is national, evolves and events are announced. So I've been working on federal issues at Boston Children's Hospital for more than 13 years now, and in children's health policy for more than 20. I worked in DC and on Capitol Hill prior to coming back to Boston, and I don't really love dating myself like that, but I say it because I want to make the point that I've been around a long time, and I haven't ever seen the level of conversation and even coordination around children's mental health happening in Washington, DC that is happening today. So as upsetting as the situation that led us here is, I do find that encouraging. And it's also a tribute to the work that everyone has done in terms of letting their legislators know that we are in a crisis. And it's also a statement about just how real this crisis is. So I want to talk about a few things that have happened recently or are ongoing, and also ways people can help. We can go to the next slide. Actually, these are all the people, all the coalitions. I forgot to reference this slide, but all the coalitions, the three that I named, CHA, AAP, and ACAP, started the Sound the Alarm campaign, and all these and many other organizations have joined us in that work, including Boston Children's Hospital. So we can go move to the next slide. And in terms of things that have happened at a federal level recently or ongoing, in December of 2021, so just this most recent December, the US Surgeon General released a report warning of a mental health crisis, making clear that the pandemic has intensified mental health struggles that were already widespread among young people in America. And the report cited many of the statistics around emergency room visits and the rising conditions that you've just heard, and called for more resources to be devoted to understanding and addressing these challenges. So then in March, during the State of the Union, President Biden also acknowledged the increasing mental health crisis for all Americans. He specifically called out children and made a pledge in that speech to boost services for them. So that was good. So now the sort of real work begins on the legislative side. And on the congressional side, we as a hospital and with our partners spent time this spring responding to a variety of requests for information, sort of formal requests that the Senate committees that deal with mental health put out. And also there were many hearings on the House and Senate sides where senators were seeking information about the crisis and trying to ascertain what is needed in order to properly respond, which is appreciated. And now we are seeing bills. We can go to the next slide. We are seeing bills introduced or getting ready to be introduced that would address these topics. So we are, I think everyone knows, living in a very partisan time, and it can be rare to see members from different sides of the aisle working together. And this issue isn't immune to that partisanship. Republicans and Democrats have different ideas about how to address these challenges, where and whether to spend money. Sometimes there's even an element of how are we going to work together and share credit and share ideas and share the solutions that sometimes at play, and it can make things difficult. But we have seen progress in this issue over the last few months, and the good news is that both sides are talking about it and talking to each other, and also talking to us and the people who are more on the ground about what we are seeing and what we might need in order to respond to the needs of all of our children. So just recently, the legislative response culminated in a signature piece of legislation that Representative Trahan referenced, called the Strengthen Kids Mental Health Now Act. It was introduced by Representative Anna Eshoo, who is a Democrat from California, and she's the chair of the Health Care Subcommittee on the U.S. Committee on Energy and Commerce. And this bill, which she introduced together with a Republican member from Pennsylvania, Representative Brian Fitzpatrick, was developed in close coordination with children's hospitals, CHA, and families who are closest to the problem. And it's designed to address access, capacity, and workforce, all these things that are related. And it's very exciting to have a bill that puts them together, like this one that was introduced in the House. Working on a companion bill for it in the Senate. And I'm going to talk about a few of the things that the Eshoo-Fitzpatrick bill would do. I think that's in the next slide. And so number one, it would support pediatric providers. You can't talk about access without talking about Medicaid reimbursement rates. They need to be increased for the pediatric mental health services to at least match what Medicare pays. They don't always, they often don't. Providing direct and targeted support for pediatric mental health providers. And this bill would increase Medicaid reimbursement. It would also create and invest in programs that support pediatric behavioral health care. The bill would establish a grant program for providers, hospitals, and clinics engaged in activities to enhance the delivery of community-based mental and behavioral health services for children. It would also fund new programs focused on developing and expanding the pediatric mental health workforce. So you can't have access if there's not a workforce there to support it. So the bill would increase investments in pediatric behavioral health services through another grant program to develop and strengthen critical pediatric mental health infrastructure and to address the gaps that exist in the continuum of care for children, which we know could include new facilities, investments in technology to facilitate telehealth, and expanding intensive outpatient services, partial hospital programs, day programs, all the things that can help get at the boarding challenges that Dr. Viziaco spoke about. where kids are in the hospital but not getting better by growing the pool of places that can help them outside of the hospital. And this bill directs real resources towards that. So that is what the SU Fitzpatrick bill would do, along with a number of other things related to guidance and best practices. And I hope that the people who've tuned in for this webinar who care about these issues will stay tuned in the coming weeks as we hopefully see a Senate companion bill introduced and continue to build support for this one in the House. The time really is now. If you're watching this event, you probably know that, that we need to keep up the drumbeat and make sure our legislators hear it through all the other noise. There's a lot of other noise because this is urgent. So if you're not a member of the Children's Advocacy Network, please do sign up today for the emails. And as there are opportunities to advocate, it can be sending emails to Congress in support of these bills, to finding ways to share your own story, your family story, your patient stories. We want to help you be heard at all levels, including the federal level. So please do stay in touch. And thank you for joining us at this panel today.
Thank you to Representative Trahan and Amy DeLong. We know this crisis is national, and therefore we need to work toward the national solutions that you've both outlined for us here today. Our next speaker, Suzanne Curry, is the Behavioral Health Policy Director for Healthcare for All and is also on the leadership team of the Children's Mental Health Campaign. Suzanne Curry, everyone.
Thank you, Amara, and thank you to Boston Children's Hospital for inviting me to participate in this event. And to my fellow panelists, I learned a lot from you, and thank you for everything that you do every day to support families and make the system better, especially to Max for your courage and for sharing your story. Next slide, please. For those of you who don't know us, Healthcare for All is a nonprofit consumer health advocacy organization, and we advocate for health justice in Massachusetts by promoting health equity and ensuring coverage and access for all. We do this in 3 ways. We have a direct service helpline, which is really the heart of our organization. We help people to apply for, enroll in, and troubleshoot health insurance coverage issues. And we have counselors who speak English, Spanish, Portuguese, and we're very excited to announce just a few weeks ago, now we have Haitian Creole capacity. One of the themes we often hear on the helpline, though, is how challenging it is to find mental health services. This is especially true for the many immigrant families that we work with every day, many of whom have faced significant trauma. We also do policy work. We advocate for systemic change to improve access to care and coverage. And we do a lot of our work in coalitions with individuals and organizations like the Children's Mental Health Campaign. And we also do outreach and organizing, working with communities to listen, educate, and engage. Next slide, please. Along with Boston Children's Hospital, MSPCC, Health Law Advocates, the Parent Professional Advocacy League, and the Massachusetts Association for Mental Health, as Amara mentioned, Healthcare for All is on the leadership team of the Children's Mental Health Campaign. The campaign advocates for systemic changes to ensure that all children in Massachusetts have access to timely care and supports for mental health concerns. Next slide. The title of today's event, Children's Behavioral Health Crisis, The Time Is Now, actually brings us back to the early days of the campaign, which started its work in 2006 on the heels of the Rosie D case, which many on this call may know, but resulted in the Children's Behavioral Health Initiative, with a report authored by MSPCC and Boston Children called The Time Is Now, which became the campaign's logo and tagline at the time. Sadly, we know, and as many of the other speakers have laid out, we're currently in a children's behavioral health crisis. So the time really is now to move systems forward that really support children and families. Next slide, please. The campaign approaches our work thinking about the structures in which children live. Family, broadly defined, school, including early education and care, and community in the broader sense and in the sense of the systems that families interact with. And we strive to keep a health equity lens that recognizes the deep racial and intersectional inequities that remain embedded in these different systems. Next slide. As Amy mentioned, on the federal level, on the state level too, state legislators and administration officials have begun to prioritize behavioral health in recent years. The campaign strives to work with these officials to ensure that the needs of children, adolescents, and their families are not forgotten in the policy discussions. So on this slide, we just lay out some of the state policymaking and funding opportunities that are currently happening, from the state allocation of Federal American Rescue Plan Act, or ARPA funding, to the annual state budget process, to state legislation and the new EUHHS roadmap for behavioral health reform. There's a lot going on the state level too, and we're really thankful to partner with policymakers who are pushing this forward. There's several more not listed here that will be important in shaping the mental and behavioral health system for kids, such as the new Mass Health Waiver and efforts to integrate behavioral health into pediatric primary care. Next slide, please. I'd like to focus the remainder of my time on two issues the campaign has worked on with our legislative champions, who you will hear from shortly, Representative Decker and Senator Friedman. And those two issues are emergency department boarding and school-based behavioral health. So as we've discussed, we all know that the pandemic has steeply increased behavioral health needs among children and adolescents and really worsened the ED boarding crisis. We're seeing far-reaching impacts across ages, as Dr. Busiaco has laid out, and also seeing younger and younger children needing acute intensive care. This problem is even more challenging for multi-agency involved children who should be getting coordinated services, but far too often get stuck in the middle while agencies decide how to pay for these services. And children with autism, other intellectual developmental disabilities, those with special healthcare needs, those with DCF involvement, are also at higher risk of getting stuck in acute and inpatient settings, even when they might be ready to be discharged because there's no placement for them. So the campaign is taking a twofold approach. What can we do now to help kids who are boarding in the ED or other settings that are not appropriate for the level of care that they need, while building a better system to prevent this problem in the long term? For example, we advocated for an online portal to help us understand in a more systemic way who is boarding where, with the goal of better facilitating access to and coordination of services. We're really pleased that the ARPA spending bill that the state legislature passed includes $5 million for this portal. Half of that needs to be designated to thinking about kids and adolescents. We're also working to reinstate funding for the ED Innovation Fund, ED Boarding Innovation Fund, intended to both reduce ED boarding and provide supports and services to children while they are awaiting the appropriate level of care. And there's a workforce development piece to this. Under the leadership of Senators Friedman and Sear, the Senate passed a far-reaching mental health bill, which includes several provisions to address boarding issues and strengthens the continuum of care from prevention to acute care. But we also need to think about how we can support children in school, where they spend the majority of their time. And we know that there's an inequitable distribution of behavioral health resources across school districts in Massachusetts, and you can imagine where these are. Right now, the House of Representatives is working on a mental health bill that we hope will complement the Senate's approach and focus on school-based behavioral health. And that's why the campaign is advocating to include the Thrives Act, led by Representative Decker, in this bill. And we're approaching our school-based work by looking across the school continuum, starting with preventing early education suspensions and expulsion, which we know disproportionately impact Black and Brown, very young children and sets them up to fail in school. By requiring schools to develop behavioral health crisis plans, they're already required to have medical crisis plans. Why not behavioral health crisis plans? Behavioral health issues should receive healthcare response, not a police response, which happens too often now. And we're looking to create a behavioral health infrastructure in schools through a school-based behavioral health technical assistance center, which we are really thankful is already in development thanks to state and federal funding, so that no matter what school in what part of the Commonwealth a kid walks into, they have the same opportunity for behavioral health supports. All that said, we know that none of these changes are possible if we don't pay attention to the behavioral health workforce. The campaign supports workforce capacity building efforts, including ensuring a range of expertise in different areas, such as early childhood mental health, trauma-informed care, and more. And we're hopeful that a combination of ongoing and new efforts in this area will create a more diverse, sustainable, well-supported, and better compensated workforce who can better support children and families, especially the most underserved. Next slide, please. So All of you on this webinar are key to making these changes happen together. As we've talked about throughout, you all have something to contribute. And we would love to ask you to join us in advocating for policies and programs that support mental and behavioral health for children and families. There's a few ways you can do this. One, we have a link on how to sign up for the Children's Mental Health Campaign newsletter and action alerts, so that you can contact your state legislators at different points in the state legislative and state budget process. And I think Representative Decker and Senator Friedman will tell you too, it actually does make a difference when they hear from constituents. We do have some other Children's Mental Health Week and Children and Mental Health Month events coming up. You can check out the Parent Professional Advocacy League's website, and they have a lot of events. And we have one in particular coming up on May 13th focused on infant and early childhood mental health. Just thank you to everyone on this webinar and all the panelists and everyone else for the opportunity to join with you today as part of Children's Mental Health Month. And let's hope that we can move things forward to make things better for children and families. The time is now. Thank you.
Suzanne, thank you for sharing your expertise and for your advocacy. Our next two speakers will provide closing remarks for this morning's webinar. Both Representative Marjorie Decker and Senator Cindy Friedman are legislative champions for increased access to behavioral health care for children across the Commonwealth. Representative Decker is the chair on the Joint Committee on Public Health, and Senator Friedman is the chair on the Joint Committee of Healthcare Financing. Both chairs recognize the urgency of the times and have fought to make real change happen in this space. First, we will hear remarks from Representative Decker, and then we will hear from Senator Friedman.
Thank you, Amara. I don't know, am I there? Okay. Thank you so much for having us here today, and thank you for really amplifying the opportunities that you have. Almost 400 people who've signed up to be on this webinar, and I think that's just a testament to how important and how urgent it is for all of us to address the needs of children's mental health and their behavioral health needs. I think of this as a parent with two middle school children, and also as a legislator who I get calls frequently from parents, and just prior to coming on to this webinar, from parents who are desperate to try to navigate how to access resources for their children. I think Dr. Ibiziaco laid out staggering statistics, right? I mean, those statistics are really hard to absorb, but if you're a parent or you're an educator or you're a caregiver, those statistics every day are being lived out. And I think that we know that prior to the pandemic, we really were struggling with how siloed our healthcare system is. And honestly, all of our systems, our society has siloed somehow our mental health needs from our physical needs. And the pandemic has only, I think, really ripped open the curtain, so people actually are not only seeing the needs of others play out, but they're actually really talking, I think, for the first time in a far more open way about the needs of their own families and loved ones. The issue of ED boarding is something that, for any parent who's ever had to bring a child to the emergency room, often we know that emergency room visit could have been prevented had that child's needs been understood, assessed, and addressed when and where they needed them to be addressed. You've heard today about a number of bills that are happening at the federal and at the state level that try to do exactly that. One of the things I always remind people of is that when a child enters the boarding room, and now because of some work I was able to do in the budget, we now have a portal that you can go on the state website and you can see on any given day how many children are stuck in an emergency room. This past Friday, it happened to be 99 children who were stuck in an emergency room, waiting longer than 12 hours for care to be seen by the appropriate provider. The problem is that providers aren't available. The appropriate programs that a child should go to on day one often don't have availability. And we know that when children are stuck in the emergency room on day 12, on day 21, and in some cases on day 47 and day 67, that they are no longer eligible for the programs that they would have been eligible for and would have been served by had those programs been available to that family on day one. I don't think any of us could sit in an emergency room for days on end and not escalate and not become a different person and more traumatized than on the first day than we arrived. And the connection to that really is important. I often say, there's no way we would allow anyone, but certainly not a child, to sit in an emergency room with a broken bone or an open wound that was festering and leave it for days and weeks and sometimes months without actually addressing it. We wouldn't do that. But the truth is, we are doing that. On any given day, we can have up to 300 kids who are sitting in our emergency rooms across the state, waiting for weeks on end to be cared for. And so there's a lot of different ways of approaching this, but one of the things that we can do, I think it's important for everyone on this. You all bring different experiences to this, but the really good news is that there's a lot of information and a lot of resources about how to address this. It doesn't have to be that way. And I think for me, that's the most important takeaway here, is that we actually have programs, we have resources, and we have the tools to meet children's needs when they need them and where we need them. Now we need to actually follow that up with the urgency and the implementation of laws and programs and budget that will allow us to carry that out. I'm so proud to have been working with the Children's Mental Health Campaign for over 3 years now. We have been working diligently to make sure that my colleagues in the legislature understand the urgency that children and parents face when it comes to meeting their mental health needs and their behavioral health needs. We know that creating a behavioral health council, which would help inform both the governor, it would inform the governor's administration, including the Secretary of Education, including the Secretary of Health and Human Services, as well as the legislature, that if we create this council as it's called for in this legislation, it would be the first time that we have a permanent place in which a lot of different voices and stakeholders, from parents to providers to educators, would come and actually meet on a regular basis to talk about how are we doing? How are the children doing? Because a lot of children aren't doing okay. And this would be that place where people actually assess, are we making the highest and the best values of our budget dollars? Are the programs and the policies that we passed, are they doing what they intended to do? Are they expanding services and reducing need? So passing this bill means that we would be creating for the first time a really cross-agency, cross-collaborative place to allow people to actually have those conversations and inform those of us who are making decisions and passing budgets and policies. It would also go on to continue creating this technical assistance center, which would allow schools all over Massachusetts to have access to hands-on training for some of our most under-resourced schools, hands-on training to understand how to assess and address the needs of children who are struggling in their schools. It would provide a portal in which providers in a school, a social worker, a school nurse could go in and say, what resources are in fact available in my community today? It would also go on to create a behavioral crisis plan in which schools have to actually put on paper. Some schools are doing this, some are not doing it, and a lot would be doing it if it was required of them, to say, what is our crisis plan? Right now, we know that too many kids get sent from school to the emergency room with the phone call to the police department because schools can't assess, in fact, what the needs are and how to respond to them. They just see a kid who's completely dysregulated and they call the police. There's other paths to doing this. And this kind of a plan, which is in the legislation once passed, would require schools to actually be able to lay out that plan, which then also allows them to have the conversation to say, are we prepared for responding to these kind of mental health emergencies and crisis? What resources do we have? What resources don't we have? And how do we make sure that kids are getting what we need, what they need, and that we're not adding to the trauma? So often when we aren't able to meet the needs of our adolescents, our teenagers, and our young people, what ends up happening is we just contribute to that trauma. And I've got to guess that everybody on this webinar knows that, and that's what motivates you to be here. So, you know, I will just say that the last piece of this bill that's really important is it also really puts a pause on how we expel and suspend our youngest students in early education and care. So often behavioral issues are seen as disproportionately beyond the actual mental health need that's needed to be addressed. We know that also whether a child is a child of color or they are coming from a low-income, under-resourced families, we also know that they are impacted at a much greater rate than other children. And This is going to allow us to assess, create data, create accountability, create tools and resources, because ultimately we're talking about communities of parents, caregivers, and educators who want to do everything they possibly can to meet the needs of their children. And we can do that. So I'm really excited about the prospects of this bill passing this year. And I want to say a special thank you to Max, who spoke out today. Max, you're really brave and you're speaking for the needs of so many young people. And I will just say finally, as a parent, the importance of this bill and all the work that many of you are doing. I know that this has only become far more truthful since the pandemic has hit. Many parents every day are struggling to assess, is what my child experiencing? Is this moodiness? Is this anxiety? Is this depressive behavior? Is this temporary? Is it part of normal adolescent development? Or is it something more serious that if I pay attention to now, it'll actually prevent this from exasperating and becoming a crisis in the future? And the truth is, parents need more tools, and our educators who spend far more time with our kids need those tools and those resources. And again, I will just say thank you to all of you. But if you listen to Dr. Ibiziako's testimony and her statistics, those statistics are born out of the experiences of families across Massachusetts who are struggling on their own, and we need to do more to meet their needs. And I'm excited to be part of this and this conversation and this movement. And I do think we will see great changes over the next couple of years, because as what was just laid out by Suzanne Curry, a lot of investments have been made by the legislature through the ARPA funds and through the state budget. And we have the opportunity to actually meet those investments with policy changes. So I want to thank Children's Hospital for all of the work that you do. And to many of you who are on this webinar, I have to believe you're on this because you're also an important piece of the solution here, whether it's telling your story or providing services or advocating. So thank you.
Thank you so much, Representative Decker. And with that, I will introduce Senator Friedman.
Thank you, Amara. Thank you for inviting me to talk on this very important topic, something that I have been working on for probably 10 years at this point, and it's a fight worth fighting. So again, I'm State Senator Cindy Friedman, and I'm the Senate Chair of the Joint Committee on Healthcare Financing. And I want to again thank Children's Mental Health Campaign and Boston Children's Hospital for hosting us today. So like many of you here, I'm painfully aware of the immediate and growing crisis our children's behavioral health system faces. I've lived it myself. And a quick look at the DPH's ED boarding dashboard shows that several hundred of these patients are typically children who wait the longest for care. Imagine being a parent of a child who arrives in an ED in the midst of a mental health crisis that requires immediate treatment, but being told that such treatment is not available, or being told that your insurance doesn't cover the service, or that no providers are currently accepting new patients, or that no inpatient psychiatry beds exist within 50 miles. This is simply unacceptable on every level. And that's why the Massachusetts Senate passed its Mental Health ABC Act 2.0 last year, which proposes a multifaceted approach to address this urgent issue. First, it creates an ARPA-funded online portal that enables access to real-time data on who is ED boarding and includes a real-time bed search function that allows healthcare providers to easily search and fund open beds using a number of criteria. So we have funded this through ARPA. Second, it establishes a complex case resolution panel to intervene and help resolve barriers to care for children with complex behavioral health needs that are experiencing long ED boarding times. Third, it requires all hospital EDs to have a qualified behavioral health clinician available to evaluate and stabilize a person admitted to a hospital ED with a behavioral health presentation during all operating hours. And fourth, it directs the Office of the Child Advocate to produce an annual report on child ED boarding and tasks the Health Policy Commission with conducting a statewide pediatric behavioral health assessment every 5 years to inform future policymakers. This is just one area in this comprehensive bill, which also includes key provisions that give the state more tools, real tools, to truly enforce parity of behavioral and physical health with insurance companies. This is long in coming and well overdue. These reforms are so important. My Senate colleagues and I are committed to trying to resolve these complex problems that too many residents are grappling with. And I know and believe my House colleagues feel the same. I'm hopeful that we will soon see action on the Mental Health ABC Act 2.0 in the House of Representatives. Thank you all for being here and for everything you do daily to serve Massachusetts residents. I look forward to our continued partnership to address and hopefully resolve the persistent and growing children's behavioral health crisis in the Commonwealth. Thank you to all who spoke before and to all who are listening.
With that, I would like to thank Senator Friedman and Representative Decker for your remarks today and for your steadfast commitment to the health and well-being of children across the Commonwealth. I would also like to thank all panelists and speakers for today's session. Feel free to unmute and get your videos on. Thank you for your expertise and your advocacy. Also, thank you to everyone who has joined us today. Thank you for your engagement. Thank you for your advocacy. A reminder that this session was recorded and a copy of the recording will be shared with all registrants. Also, if you have any questions, please email can@childrens.harvard.edu. Thank you all.
Thank you.